There is so much that you can do to build out something that's going to add value. It takes a lot of time. And it takes a lot of, like Jennifer, I loved it when you said, try to break it. Because you do want to trial it out, but for patients who want more hand holding, something like this is it really is a great tool.
Welcome to the Super Clinic Project Podcast, Coach's Corner Edition. Ready to boost your practice by 10,000 in just 10 minutes? Join your coaches Jennifer and Tracey for fast and proven strategies that drive real results. Let's get started.
Welcome to the Super Clinic Project Podcast, where we take regular clinic owners and we turn them into super clinic owners. Today is Coach's Corner, and you are here with Tracey Sundkvist and me, Jennifer Gligoric, and we're here to give you $10,000 worth of advice and revenue in your business within 10 minutes. And today's topic is digital transformation in remote health services, the rise of telehealth and digital forms, and how you can use them for you and your business to more effectively connect with your patients. Tracey, take us away.
I tell you, just recently I've had a conversation with an AI chatbot, and I don't know if you've ever done that, but I tell you, it comes to a certain point where you have got to speak to a human because AI only takes you so far. So I think the important thing to remember here is AI does not replace that personal touch, right? It doesn't take the place of. It is supposed to be an add-on. It's supposed to improve the quality of what it is that you're delivering, not to replace it. So, there always has to be the ability for people to speak to people instead of a bot.
Yeah, absolutely. The biggest thing I see is, especially with clinics or any service-based business owner, is that you guys won't test it out first. You won't test it on you to see how much you like it. So my first word of advice is don't get sold until you can try it out and you can test it and you decide that you like it. And I mean, you really are going to have to test it, or you're going to have to pay your kids to test it for you, or, figure that out. If you have kids, you can have them test it, ask them all the questions, try to break the thing, right? And to work with it. And I'm talking about, it could be a chat, a certain chat, asking them some questions and then getting them to book with you. It could be, there are very different ways that you can utilize, AI and digital transformations in your business. I think one of the bigger ones that is having the best impact is telehealth. And I don't believe telehealth is utilized properly enough for most clinics and service providers. It should never take the place of a physical appointment because that is where the power is. However, though, you can get a lot done on telehealth. You can do pre-screening. You can, depending on what you're doing, you can sign people up and take their payment and have them just come into the office for the service that they need. There's a lot of things you can do with that. And the good thing is that there are a lot of sites and EHRs that have telehealth built in. We work with Peak Wellness Labs and we have Jane. We love Jane. Telehealth is built right into that. And another one is BodySite. In fact, we're going to put the BodySite code here just for you guys that are listening. You can get an entire free trial for them and then a discount if you use our code. BodySite, you can really revolutionize things with that. And Tracey helped build out our entire BodySite. Can you talk to them about that a little bit?
Absolutely. So this is such a great add-on to really improve the quality of the experience for the patient. So what we built out was, of course, it was for a health-based 8-week challenge. But what's great about BodySite is that it has menus in there. There's place for videos in there. So you can literally, on a day-to-day basis, have messages going out. So you can send personalized messages across their care plan. That's one way to use it really well. But the other thing is there's so many add-ons. There's videos that they can watch if you want them to do a specific set of exercises every day, for example. You can literally have videos on this is how you do it, and so you can incorporate that. You can incorporate tracking mechanisms. So if you want them to track their blood pressure or their weight or their pain levels, there's tracking built in as well. So it can really be a one-stop shop that is a kind of a platform that sits between yourself and the patient. So the patient gets an incredible amount of value because they can access everything that they need from this place. There is a place that is just about them where, whether it's forms that they need to complete, whether it is tips and tricks or extra information on specifics around their condition, there is so much that you can do to build out something that's going to add value. It takes a lot of time. And it takes a lot of, like Jennifer, I loved it when you said, try to break it. Because you do want to trial it out. But for patients who want more hand holding, something like this is it really is a great tool.
Yeah, it is. It's a great tool. And so what we're talking about, it's a program called Body Sight. And effectively, it's an app that patients can have on their phone. They can even access it on the web. And it tells them every day, like, welcome, Susan. Today, you're going to need to drink 3 things of water today. It might tell them, you might be experiencing this during your treatment. If so, let us know by filling out this form. And then it gives them the form and they just do a couple of clicks. We've seen this utilized in psychology clinics, like ketamine, where people are taking them through a journey and they're wanting to really follow up with them, journal how you're feeling right now, how was your day, how have you made different choices, and they can give feedback on this that necessarily doesn't need instant communication, right? They can just be putting it in as it happens, and everybody has their phone in their hands now pretty much all the time. Even older people have access to their phones, and this gives them a way to really chronicle, to have if you're treating them, to have like a wealth of data of what they've been through since the last time that they've talked to you, but also too, because you can put in your own forms, you can put in your own ratings, so you can see it more as a glance. For larger clinics, a lot of them will have a case manager and they'll have certain people that they're following, or they'll reach out to them. What we've seen is the people who use programs like this, there is very good patient retention. Because the patients are being talked to all the time. You don't just see them and then you don't see them again for 3 months, and then they don't show and they reschedule, and then they just kind of fall off of care. You have a tendency for patients to commit to the plan and go through the plan the entire way, because every day they're getting something positive. How are you feeling today? You got to keep it through. Remember, one step at a time. Today is the day. Choose yourself. Choose to continue to do this. And if you're consistently uplifting like that and you build them out, they have a tendency to go along with that journey with you and feel more supported. And it also gives a more concierge level of care. It gets them out of feeling like they're just a number. They're sitting in this very sterile concrete room with bulletproof glass, and the nurses aren't paying attention to them. And they just get, the door opens and they call out this random name and they're hoping it's them. That's the experience, really in most healthcare establishments, whether we want to admit that or not. And so this is a way that you can give them more of a bespoke experience, because they're on their apps, they're on the TikTok, they're doom scrolling on Facebook. They might as well be doing something that's positive for them. So we found tremendous help with stuff like that.
Yeah. Something that we built in as well was we built in 5-star reviews. So there was links in the app where they could literally just click and leave a 5-star review, which made it simple, and even to testimonials. So they could submit testimonials, all of this automated. So there were the reminders that would go through. There was also links. So they would get it's almost like an affiliate number, and they could refer people. So it's great to connect as well, because if they know people who could benefit from, what it is that you're doing, you need to make it, if you make it really, really simple for that person to refer and have the person who they're referring to you actually come through and show up, it's really just, that is such an incredible tool for organic growth. So where you can automate these, now I'm not saying that the automation of it completely takes over the human part of it, but where you can automate, this is a fantastic tool to be able to do that very effectively.
Yes, and you can build this in a variety of systems. We really like BodySite. We think they've got a great team, and they're building it out, and they're getting a lot of support. And it's great when they have clients that are on forums saying, "How about this?" And then their team goes, "That's actually a really great idea. Let's put this into development." And they're very dynamic, right? So that's why we like it. But there are other EHRs that are doing things similar. The idea is just elevating the experience for the client, right? For the patient. And this specifically works well. So let me clarify that before we go. This specifically works well if you have an actual program that people come in and you're taking them to a higher ticket offer. And so they have to commit to you. There are certain things that they must do, and you're doing with them over a period of time to get them to an end result. That's when programs like this work really well, because they're able to request a telehealth appointment with you for 15 minutes, just have a check-in. They're able to feel like they're much more supported. And when you incorporate that and say, we're with you the entire way, we're going to help you get to this goal. You just need to commit to that, but we make it easy. You don't even have to think about what you're supposed to do that day, because you're going to be prompted for it. That is really the kind of hand-holding we're talking about. It's not you're doing it all the time. You have a system that's reaching out to them, reminding them of what they're supposed to do, and it makes it easier for them in their busy days. So yeah, we want you to be able to utilize things like that, because digital transformation, remote health, it is just the wave of the future. It's going to, just be, pressed together with our in-person experiences that we have to only make it more powerful and better. Anything you want to tell us before we go, Tracey?
No, AI is here to stay. I've said it before. It's just about finding ways to use it that is going to work and to take away some of the busy work so that you can stay focused on the important things.
Absolutely. Well, this has been Coach's Corner. That's your 10,010 minutes. Take this, utilize it, and don't forget to use if you decide to check out BodySite for yourself, that's BODYSITE, and our code is 5B as in boy, 150D as in dog. And we'll put that code in our show notes. Be sure to like, follow, share, and give us a 5-star review. It's how we're able to get this information out to you so you can up-level your practice and make 10,000 in 10 minutes. Have a great day. Bye-bye.
Thank you for listening to the Super Clinic Project podcast, Coach's Corner edition. If you would like to work with Jennifer or Tracey to 2 or 10x your business, then go to superclinicproject.com and click on either Jennifer or Tracey's photograph to book a complimentary session. Your greatest breakthrough is just a session away.